Good evening, all. After a long time, I just wanted to share a short video on imaging and education to the patients. So, what is an important education that as a physiotherapist we supposed to give to the patients who has been suffering from chronic low back pain or neck pain, like non-specific in nature? Recently, I have gone through a wonderful article which is an evidence-based one in British Medical Journal, that is, do not routinely offer imaging for uncomplicated low back pain, by Amanda Mall et al. And the team, published on 2021 in British Medical Journal. So, what education as a physiotherapist we supposed to do for all the low back pain patients? For example, even though the patient referred appropriately for physiotherapy and medications by the doctors or specialists, the patient are compelling the doctors or specialists to refer for imaging, especially X-ray, CT scan or MRI. What's the specific reason? There are two important reasons for this compelling of references. Number one is other peers. Somebody might have taken this X-ray, scan or MRI and they may have a problem of red flags, serious pathologies like fractures or disc pathologies or infections like. So they may assume that the same problem may occur for us. This is the number one reason. So this gives a more impact for them. Next, initially they may have taken treatment elsewhere, physiotherapy, medications in different resorts, even in the remote places also. Their pain may not be get subsided. So they wanted to self-monitor themselves whether the cause of the pain may be due to any serious cause, pathology or something like that. So because of the two important reasons, they compel the doctors to refer this imaging. This is the main important thing. So as a physiotherapist, what to know and what to educate. So I just wanted to tell you very briefly, less than 5 to 10% of all low back pain are due to serious pathology. That is red flags, TB spine, cancer, vertebral fractures, gross osteoporosis, ankylosing spondylitis or any disc pathology like prolapse, claudication, canal stenosis, etc. So remaining 90 to 95% has no indications of serious cause, so can be managed by education, reassurance, conservative treatments like medications, physiotherapy, exercises, cognitive issues. If the patient is having any psychological problems, cognitive therapy and so on. So there may be a diagnostic triage which I will be attached below this video for everyone. I am forwarding down. Based on that, we can easily differentiate the specific and non-specific low back pain. And imaging, if we take for a simple low back pain, what will happen? It prolongs the recovery. Periodic time will be increased because of the psychological upset, because same disc pathology, disc prolapse or disc bulging may be noted in the asymptomatic individuals also in MRIs or CT scans, which is very common as evidence-based one. And even due to the aging process, the degenerative changes are common. So like a gray hair. So we cannot able to confirm. We have to correlate with the clinical checkups, history and detailed examination. So proper education and reassurance. What is the education that we have to give? We should not worry, nothing to harm. Your hurt is not equal to harm and it will be get subsided. Don't worry. Like a positive words is a reassurance, and it will reduce automatically in acute phase of low back pain. Even for non-specific cases, the anxiety, stress and fearness will be reduced. So this reduces unnecessary imaging. So this type of education, at least 2 minutes or 3 minutes, we have to speak with the patients, because patient unwilling to take physiotherapy. They are coming for the terminal hospitals like medical college setup only for this imaging. So only few percentage of the peoples needed imaging, in which the doctors or clinicians suspected this patient is having red flags. So keep educating the peoples and give physiotherapy. Thank you, one and all.